GP Connect is the link that enables information to flow between different clinical systems. There are 4 capabilities within GP Connect. The first one means a clinician will be able to see a view of a patient's records, the up-to-date medicines, allergies, patient problems, and the last 3 GP consultations.
One of the biggest strengths is getting the GP data into hospitals, and one of the advances over the last year has been the use of GP Connect and working with NHS Digital and primarily working with EMIS in the first instance to develop that record, to get rich GP data directly to the clinicians in the hospital when they need it.
We have to break the walls, we have to break the silos of the healthcare system, and GP Connect is the perfect way for doing that between primary care, acute, health and social care.
As a cancer doctor, I need to provide really complicated treatments to patients with really complicated medical problems. One of the key elements of care that we need to know about are the details of care that the GP has been providing, and now particularly we have the text of the consultation between the GP and the patient, and that is the true detail that we as hospital doctors have been desperate to retrieve from a GP record.
In A&E we see anything and everything, and the ability to see a really well-structured set of information about a patient is revolutionary, it's life-changing. You can stop unnecessary admissions, you can speed up care just by having the information.
So very soon after implementing the system, I was on call one weekend and was asked to see a patient who had been referred to the hospital but had never been seen by a clinician within the hospital. I had detailed information about the consultations, talking about how, in light of the very advanced nature of his cancer, he didn't wish to pursue active treatment. And therefore, when I met the patient, I was able to give the clear view that I was aware of that information and tailor the conversation directly to that, rather than going in entirely blind as I would have done historically and had to discover that information through prolonged and protracted questioning of the patient.
This, for me, is how our projects will be run in the future. A true collaboration where we work together to understand what the benefit is, with the patient at the centre of what we do and clinical input at every step of the way. Working with EMIS on that has really brought a new life to how our team here in Leeds works with different suppliers. A real partnership piece of work.
The idea of a project of this size happening without EMIS would be a fairly alien concept for us. We can share all the structured, richly coded information we have in our systems to power someone else's workflow at the point of need.
I think this is really important for Leeds. It means that the patients and public of Leeds are getting the very best health care that's possible to be delivered. This is, however, something that the rest of the country absolutely needs to implement and needs to implement at pace.